I'd like to talk about breast reconstruction. There is a lot of patients who suffer from the breast reconstruction now, and there's multiple mode of reconstructions now. Basically, there are two kinds of reconstructive procedures now. One is the procedure where we use implant, and the other is the procedure where we use your own skin and fat. They are called autologous reconstruction. Each procedures have its own benefit and disadvantages, and also the result may be quite different in terms of the naturalness and symmetries and all the other issues. So it depends on the patient's shape and volume, height, weight, and breast size, and all those things needs to be considered. At the same time, the treatment for the cancer, such as chemotherapies and radiation, also affect the decision on what type of reconstruction one would undergo. So I'd just like to explain just briefly about these two options first. The implant reconstruction is essentially after the removal of the breast, we will place an implant. Sometimes we are able to save nipples and areola so that we can go directly to placement of the implant. But often they have to remove the nipples or skin is short on the mastectomy side. So we have to place a temporary implant called tissue expander. And this expander is stretched and enlarged over a course of time to stretch the skin so that eventually we'll be able to have enough skin to replace the tissue expander with a permanent implant. That requires two-step operation. On the other hand, the autologous reconstruction typically involves the use of the skin and soft tissue and fat in the lower abdomen, and typically called the tram flap or deep flap. And essentially, this lower abdominal skin is being moved to the breast. This can be done on both one side or unilateral or bilateral. This procedure is because it takes longer time to perform, and also it requires significant technical expertise. And particularly the deep flap takes quite a long time with many personnel involved. The benefit is, in the long run, they tend to have more natural breasts, and one can avoid any type of risks or potential complication related to the implant by having the autologous reconstruction. However, the recovery from this type of operation is a little bit longer, and a lot of times the carries a little bit higher risk of complication. So either way, once you're confronted with the diagnosis of breast cancer, it is essential, of course, you have to go to find out what kind of treatment options are available. But on top of it, you have to talk to a plastic surgeon regarding what kind of reconstructive options are available in conjunction with the breast cancer treatment. Before you decide which type of cancer treatment you choose, I will encourage you to see a plastic surgeon prior to undergoing such treatment to understand and learn about what kind of treatment options in terms of the reconstruction